Hi friends, Dr. Nancy Trimbley here. We're talking today about helping your sciatic nerve. This is a chart, kindergarten chart of nerves. This very big one that goes down the back of your leg that comes from your lower back is a sciatic nerve. It's not the most important nerve in your body. All your nerves are equally important, but it is the most famous because it is the largest nerve in your body. It's about as big around as your thumb, and it does run straight down the back of the leg. It does split off behind the knee. Part of the nerve goes to the foot, the other part continues down around the side of the leg. So what can happen is you can have sciatic nerve tension from your lower back and need adjustments on your lower back to relieve that tension. You can also have compressed nerves, which will create a weakness in your leg, loss of sensation, maybe loss of reflex. Today we're going to talk about what happens if the nerve itself is trapped in the soft tissue of the leg, maybe from sports or injury, and you get scar tissue that's kind of tugging on that nerve. So we're going to be learning about nerve flossing. I'm going to tell you a little secret. Those of you out there that when you're sitting and straighten your leg and feel tension in the back of your leg, it is not your hamstring muscle. In order to stretch your hamstring muscle, your butt and your knee would have to move further apart like this. You're moving your pelvis to stretch the hamstring muscle, but when you just raise your leg, and you feel tension in the back of your leg, that's your sciatic nerve. So that's an indication that you need to do this nerve flossing. So essentially what you need to do is you need to move the nerve from your skull, from your brainstem, down through your leg. You're trying to move that nerve back and forth. And when you do this properly, it's gonna feel crazy because you are feeling your nerve. So what you want to do is you want to essentially be pulling the nerve. So you're going to flex your leg underneath your chair and bend your head forward, and then you're going to extend back like this. And you're going to do almost like a seesaw effect so that you're moving your nerve, your sciatic nerve, through the soft tissue. And you're going to do this 4 to 8 times. Now for me, I don't feel this at all. Knock on wood, I have no sciatic nerve tension. But if you're that person that does, holy moly, you're going to feel it. And you don't want to overdo it. You just want to do it 4 to 8 times on one leg. And then even if you don't have problems in the other leg, do it in the other leg too, because sometimes working on the opposite side will help the side that you feel pain in. So that's all for now. Remember, we're putting the power and knowledge of your health back in your hands.